Welcome to Bridging the Gap, where we seek to bridge the gap between therapists, clients, and what actually happens during therapy. Hosted by a licensed mental health clinician, we explore the intersection of the human and clinical side of what this whole therapy thing really is. Hello, and thank you so much for joining us on today's episode of Bridging the Gap. I am Caroline Dumond, licensed marriage and family therapist, and today I have the pleasure of sitting with Kerisha Prince, our psychiatric APRN here at the Bridge. So thank you so much for joining me today.
Absolutely. It's a pleasure.
Yeah. So, I feel like this is such an important conversation for us to have, not only to talk about, how APRNs, the mental health, the psychiatric side of mental health, and how the psychotherapy side of mental health kind of meet each other in the middle and integrate and how we work together. So let's just start off. How did you, even just briefly, if you don't mind, how did you get started in psychiatric care?
In nursing school, I was always a fan of when we got to the section for mental health. It was very intriguing for me. Like it drew me. I'm a very passionate person and I'm a very caring person. So it was wonderful to meet people and know that I could make a difference in their day in just even psychotherapy and just conversation. So I've always was drawn to that. But, I took the path of being critical care, cardiac nursing for
Wow.
years. And then I got into management of methadone, nursing supervisor for a methadone clinic. And it was just doing my evolving of being a nurse. I've learned that in every aspect there's mental health. Every aspect of medical is mental health. And I just keep getting drawn to it. I got to trying to do my master's in leadership, did it and realized, oh my God, I really do like mental health when I started doing that and working with methadone patients and having the full autonomy of figuring out how to connect clients with mental health providers. And I decided to go back to school and it's just been history ever since. It's just something I love to do and just enjoy being able to help my clients have a better way of life.
Wow, that's really impressive. And two, I think even to what we're speaking to in today's episode, the larger topic here is, the benefits of, having that collaborative care.
Absolutely.
And having multiple lenses coming in through the same hub, right? When other people have outside med management and APRNs that they see in conjunction with us. Obviously that's worked out great, but there's something different about having my patients see you in the same building that they see me and getting to collaborate with you and see things through your lens and vice versa,
Correct.
that I feel like really allows us to give a full wraparound sense of care.
Absolutely. Absolutely.
So there's less fragmentation of care. You're not feeling like you have to, it's in a way, it definitely takes a lot of the responsibility off of the patient themselves for their providers to collaborate and communicate.
Correct.
Because I see you walking down the hall and I say, oh, I need to have a conversation with you. And that's just such a beautiful part.
Absolutely. I love that dynamic of being in the same building and having the connection that we have and being the easy access instead of definitely, as you said before, having the clients having to fill out forms here and there and
Right.
trying to connect with another provider that we don't know what's going on in their world. So we have a world that we understand. We have this dynamic of this is what we're trying to do for the best care of the patient. So definitely working with therapists has been like the most amazing things. I've worked in other places. I've worked with places where they have other therapists, but it's not as connective as it is with the Bridge, which I love so much that I'm able to shoot a message. Hey, I just saw this patient today and they mentioned this. I know you're seeing them tomorrow. Can you touch on that a little bit more and get back to me to let me know if medication is working well or we're looking at a different diagnosis, which is just awesome. We can have this conversation before we have an intake with a client
Yes.
that already started therapy, and then there's more insight that you can give me in their IA session for me to do their intake to say, okay, let's talk about medication management and what's scaring you and things like that. So there's so many doors open
Yeah.
to have this connection that I truly appreciate and has made me grown a lot more as a provider.
Oh, well, I mean, I know, your role that you've played here at the Bridge as our APRN has really helped to shape that relationship between our clinicians and med management side of things. And I think on all sides that we've been able to grow and benefit. And even more beautifully, our clients get to benefit from that.
Absolutely.
Um, let's back it up for a little bit, just a little bit here. As far as, let's say, a client or a patient is receiving psychotherapy services and maybe they've been in treatment for a few months or maybe a year. what is typically what are typically the common signs, common denominators, um, common factors that would lead someone to possibly consider med management as in addition to their mental health care?
Okay. So
Not a simple question.
it's not, but it's definitely geared towards the client. It's where you are in life right now. Do you want to continue where you are in life? Yes, you're having these tools that you are utilizing, but there's just something missing and you can't put your hand on it. That's where you can say, you know what, maybe I do need to have a conversation with a provider. It's never a, yes, I'm going to go see a provider, a medication management provider, and I'm going to walk away, but she's going to give me a medication
Right,
for whatever it is.
right.
No, it's a conversation because as you know, the wonderful therapists do the amazing job. The medication management could also educate, which is what the prior for me is the most important thing for me when I'm seeing a client is educating them about their diagnosis, their symptoms, and how medication can help. And the stigma with the medication that we can also touch on what's making it so challenging for them to start.
Yeah.
So it's an education session when you think about medication management. It's never try not to ever think about it as, oh, I'm gonna be on a medication. No, it's for me to educate you on the medication and what it could possibly do for improving your life.
Right, your options. And that's part of what I tell my patients all the time that are considering medication management. Um, Even if you go and schedule the session, you go to the intake, let's say you get prescribed something. You don't have to go pick up the prescription if you really don't want to.
Correct.
Let's say you even go as far as to pick up the prescription from the pharmacy. You don't have to take it necessarily, but giving yourself the opportunity to have the conversation with someone like you,
Mhm.
who can, like you said, a big part of that conversation is education,
Mhm.
and letting people in on the ways in which they can take control of their own life and their own mental health care. And it is about what you feel is right for you at the end of the day.
Correct.
No one's going to make you take anything.
No, and that's where you ask all the questions. That's where, my approach is to have a comfortable environment for you to ask questions, gain knowledge, and it's a let's talk about this. This is your life. This is what I'm here to help you make the decision for yourself. I'm not making the decision for you.
Great point.
So that's where it's a conversation. And majority of the time it's a great opening for a lot of people who don't know about medication and how it helps and the stigmatism of all the side effects and all these things. When you're educated about what's a possibility and possibly no side effects, it's kind of like, oh, eye-opening for a client.
Absolutely.
Yeah.
Kerisha, what would you say is one of the main concerns that or fears or hesitancies that you see, especially like first time patients come into your office surrounding medication management?
Let's be frank, I'm crazy. That's definitely the biggest thing that people get scared about when taking medication. If someone knows I'm taking medication, they're gonna think I'm crazy.
Yes.
They're,
The stigma.
the stigma of it all. And the comfortability of understanding medication and seeing this amazing world that we have evolved into, that a lot of people are conscious about their mental health, and to know that you can have these conversations again about what the stigma is around it, and what we can how your life can be much better with medication.
Absolutely.
So it's yes, they do have that stigmatism, but then it's the helpfulness of therapy again
Sure.
with med management, and having the same conversation. They're driving the same statement that's drived in medication management is what's drived in therapy. So more than one people saying the same thing, or continuing to say the same thing
Yes,
around the concept of therapy and medication management, that will definitely help with the stigmatism.
for sure. I completely agree. And again, I think a really helpful a really helpful framework to kind of look at this system is these are all very important pillars of care.
Mm, absolutely.
And so if you start off, and I also understand the whole concept of you don't want too many cooks in the kitchen,
Hmm.
right?
Yeah.
So I understand people initially starting off with just psychotherapy.
Hmm.
Let's see if I can build the skills, the coping skills, kind of process, uncover some stuff that way. And then if there's something like you were using the language, it's you're almost there, but you're not quite right there. Looking at again those other pillars, and not just medication management, but I look at it from mind, body, spirit,
Hmm.
right?
Hmm.
So what are the other pillars? Okay, clearly you've been coming to therapy every week. You're engaged. You're bringing good stuff in. So let's start to explore those other pillars of your life and see where maybe there's some needs that aren't being met.
Correct. We can improve those things. We can improve those moods that you can't control. Those dopamine and the serotonin that's in your brain. You are not in control of that.
No,
So these medication will assist in that. And as we always mention, a lot of people are scared of being on medication for the rest of their life.
I'm happy you said that. Yep, I was just going to bring that up.
Yes, and that's
Like, is
not.
this going to be forever?
No, and it's some medications, yes, it depends on what diagnosis you may have. But again,
Sure.
I don't treat diagnosis, I treat symptoms.
Yes.
So if there are diagnoses that you may have that requires you to be on a consistent medication, that's a whole nother conversation. But if there's a conversation about just symptoms that you're having during this time that are just based on situations, that we can definitely get you to a place where, okay, the medication is helping me be a little bit more calmer, so I can deal with the situation. I can use all the skills that I learned in psychotherapy to function through life. Like, okay, I'm calm enough to remember the things that I've learned in therapy,
Yes.
so I can utilize it.
Yes. And
So,
again, it's working in conjunction.
correct. So it's a tool. Hey, that medication is hitting my brain. Oh, my brain is opening up to all the things that I remember
Oh,
in
now I can
therapy.
remember yep, exactly.
There you go.
Exactly.
So that's how we have to have that conversation. This is why I keep saying that I love it. I love the bridge for that same reason, because it's like we are under the same umbrella with the same thinking,
Yep.
and the purpose and the goal is for the client.
And on top of it all, more just to drive home the point that you brought up, we're specifically being able to work together under the same roof and within the same agency. That allows us to have more continuity in our language that we use with our clients.
Correct.
So
Yep.
I can sit there and have sessions with my clients talking about very specific coping skills with, specific language according to the modality or the model of therapy. And it's really great that even from a different lens, you're able to reinforce and use that same language to further support the whole process.
Correct.
Um, what would you say about any common concerns that you tend to see from, because we work with a lot of parents
Mhm.
and treating their children.
Mhm.
Do you see any common concerns or common messages or themes lately working with specifically parents and helping them
Mhm.
navigate their child's mental health care as far as medication? And it's
Absolutely.
complicated, right?
It is complicated, but it's as a provider and as a therapist, we have to understand generations, different generations and different mindsets. Um, an adult with ADHD, parents would tell them, go sit down and go focus and do your work. You're just being
You
lazy.
need to try
You need to
harder.
try harder. That's the education they have had coming into having their own kids, and they're learning as they grow. As I said, there's no handbook for parenting. There's a couple of handbooks, but
But it's not one size fits
it's not
all.
one size fits all. Oh, absolutely. So it's also educating, seeing where the parent is and what their reservations are or challenges are when it comes to medication, and having to have a psychotherapy session along with the parent with dealing with medication.
Yeah.
And as I said, people fear what they don't understand. So when there is an understanding of what's going on with
Yes.
their child, how medication can improve, and how they can help support their child while helping themselves learn the things that's happening, it's so much more easier. But for me, it's something that you have to understand as well. And when you're going into someone that's their child, that's their
Oh
precious
my gosh,
baby,
yes.
you have to understand that dynamic as well before you go into and just say, okay, no, but it's about helping your child. No, we have to understand what they have gone through to get them to the place where, okay, this is not just only for your child. This is going to make you feel better because you're anxious,
Absolutely.
you're nervous that your child is going through a
Yes.
situation that you can't fix. And as parents, you want to fix everything about your kid. So you have to make sure you're gearing towards that side. So it's it is challenging at times, but I find that when you definitely get to that baseline of what's the challenges are in the dynamic of the family, you can then help the child even more and the parents.
Yeah.
Yeah.
That's wonderful. I know another concern that I often hear in my office, and I'm sure you hear the same in yours, um, is, and this is such a natural fear. What if I take the medication and I don't feel right?
Mhm.
What if it makes me feel off? What if any of those? What if I get negative side effects from that? How would you? What are some of the common messages that you like to share when it comes to that specific fear,
Mhm.
and maybe just to kind of provide more of a reassurance and comfort over that having that conversation with your APRN or
Mhm.
any med management provider, where it's, hey, we had this conversation. You said this was probably going to be the right medication for me, but I feel off right now. What do you do then at that point?
Okay. So in that portion, there's a setup before they even leave the office with the medication. Once they agree to take the medication, there's a setup, there's a conversation. I'm giving you the lowest dose possible. So you may have the few side effects that may happen with the medication, or you may not have any at all. You may not feel any changes at all. Okay.
Right.
This is the reason why we start slow and low.
And depending on the
The
medication
medication.
technology, sometimes there's a therapeutic dose that has to be reached.
Correct.
And yeah.
Correct. If they started taking the medication, and because some people are sensitive to medication, even if it's at the lowest dose, there's a time period that I always explain to them, 7 to 14 days. If you are feeling these side effects and they're getting worse, that's the education that we have. If you're feeling these side effects and it's just like, oh my God, I'm feeling this, but it's subsiding, that's when you have to stick through the medication because the medication is building up in your system over
Okay.
time, and then it will subside. These things are supposed to subside. But
Right.
if there's danger or if there's dangerous things that is happening, this is also talked about so they know the difference. But yeah,
Yes.
you may, and this is an option that I always give them. If you're taking the medication and you're feeling something that's happening, you can always reach out to us, leave a message. I would call you back before the end of the
You
day
do not have to wait until your next
appointment
appointment.
to talk. And
You need a refill, you need anything like that.
the biggest point is you're seeing your therapist every week or every other week. They have more access to say, you can tell them, hey, I started the medication, but this and this is going on. And I'm telling you, multiple times I'll get a message saying, hey, can you reach out to this person so you could talk more about what's
Yes.
happening? And it's always once they hear what's going on, or you get to reassure them of what symptoms they're supposed to be feeling. A lot of patients feel much more better. And
Supported.
yes, the support is there, and then when they come back, most of the time, they're like, "Oh, I did feel this way, but then I'm all right now."
Right.
So
Right.
it's just having that support all around that helps with the medication management.
Absolutely. And two, I think a really important point to bring up, and I think, people getting to see your personality and how you kind of operate. This is how you are with your patients
Yeah,
as well.
it is.
Um, and so I know some some patients can definitely feel a little intimidated when it comes to um, talking about negative side effects or fears surrounding medication, or coming off as like questioning your expertise and whatnot. Um, but just, even working with you as a colleague and whatnot, you're very open to explaining exactly what your thought process is and what your justification is. And so you welcome those questions.
Absolutely.
And it's important for patients to know and trust that they can come in, they can ask any question about it, even the same question multiple times if it's going to
Correct.
make you feel better.
Absolutely. Absolutely. Just as until you get the driving force of what we're trying to do and you understand that this is going to benefit you and it's for you, then you can ask me as much questions as you like and we can communicate and talk about it as much as possible.
Definitely.
Comfortability is very important, and just having that comfortability to be approached about anything. I'm very, very much have that type of relationship with my clients as, I come in and take your blood pressure and I see your heart rate is like skipping. I'm like, oh, whoa there.
Yes, yes.
I know you're happy to see me, but it's okay, and it's just the
Right.
laughter,
The
the making
human
it
quality.
the human quality to let them know, hey, I'm not here to feed you pills. I'm here to make sure that you are where you need to be.
Right.
Yeah.
And if a patient comes into your office and you don't feel medication is necessary,
Absolutely.
are you going to say that?
Yeah, absolutely.
Yeah. So it's
Absolutely.
almost like that, I try to reinforce this with a lot of my patients. Just because you go, and I know I said this earlier, but just because you go and you have the meeting, um, you don't, first of all, you don't even know that she's going to prescribe you anything.
Correct.
Okay, I don't even know that she's going to prescribe you. It's not my wheelhouse. So knowing that it's not like you're locked into a roller coaster ride. You're still in full control of where that path takes you and how far you want to go down that path.
Absolutely. And even if you do take the medication, you come back for a follow-up.
Yes.
And
Which is usually when. So they come in for their intake with you, and then typically it's how long
and
after?
it depends on what medication too.
Okay.
So if it's like a medication that I know needs to be built up 7 to 14 days, I'll give you a full month
Okay.
for you to
Like an
get to,
SSRI and
yes, SSRI. We'll
Okay.
make sure we give you that point for you to get, if there's any side effects, get to that portion and start to actually see some type of, how did I handle that situation?
Yes.
Or there's a little change there. It's not as much, but I still feel some anxiety or still feel some depression, but it's not as heavy as before. Then we can have that discussion when you come back. Also, we can have that discussion like, oh, Kerisha, this medication made me feel like weird or stuck into the feelings and I wasn't able to feel.
Yeah.
Then we can have that discussion as well to say, okay, maybe this dose is a little bit too much for you.
Not able to feel. I thank you for saying those words, not able to feel, because that's actually a very common concern I hear from my patients is, well, I don't want to feel numb. And, correct me if I'm wrong, because this is your wheelhouse, but I do try to reassure. I do try to reassure my patients, listen, if you take this medication, whatever medication is prescribed to you, and you feel numb, it's likely not the right medication.
It's not the end of the world.
And it's not the end of the world, because also, it's the medication and not you.
Correct.
And that's been a big comforting factor and reminder for people of like, well, what if I feel a certain way? Then it's because of the medication and it is not just simply something wrong with you.
Correct.
And then that provides you with information to go, oh, I need to talk to my med management provider because this doesn't feel quite right. Let me have a conversation.
Correct. And as we say, no medication is perfect, because what can be right for you may not be right for someone else, because we all have different receptors and
Yes.
and we can definitely say, okay, yeah, maybe this one is not right. There's more than one medication in an SSRI. There's more than one medication for antipsychotic. So obviously there's more different ones.
And the trial and error period can feel frustrating. It can feel defeating, but what I say is it's worth it.
It is.
Because you will find the right combo.
And just to not feel the way that you're currently feeling.
You deserve to not feel that way all the time is one of the biggest messages.
Absolutely.
Right?
Absolutely. My biggest is just adults with ADHD that were never diagnosed,
Oh,
and then they start to get their medication management with,
it's life changing.
and they're just like wanting to cry because they're like, why did I have to go through
Yes.
through life
It's like that
this?
scene in Mrs. Doubtfire when she finds out Robin Williams is Mrs. Doubtfire. She's like, the whole time, the whole time. I could have been like reading without all this noise going on in my head. And it's like, yes. And, you know, I hold such a big respect for people that really want to dig through their stuff. Even the people that, okay, I want to dig through my stuff before trying therapy. That's fine.
Mm.
But after you're digging and after you've tried it, you owe it to yourself to try different avenues and to see what's going to work and what's not going to work for you.
Absolutely. Yeah.
So
Yeah.
just leaving off, I guess, as a final note or two, do you have any big or small pieces of advice for anyone considering med management alongside psychotherapy? Maybe someone who's hesitant.
Okay. There's two sides to that. For the people that have tried med management before and had a really sucky time
Yeah.
with medication and providers, and or the mental health aspect in life with your own personal life and just the mental health industry itself, try again. It's going to benefit you. You're going to find the right fit, the right provider. The Bridge Family Center is here. That's one of the main things I'm going to say for the people that have done it already and are and have struggled and just decide to not touch medication again.
Right. Or even not touch therapy again.
There is
right time, right place, right provider.
Correct. There is a symbiotic place here for you, and the education is here for you, and it's not the end of the world, and you don't have to continue to feel the way that you do.
Absolutely.
And for the ones that are like still thinking about it, you know, you get that one shot deal. It's a win-win, you know, and it's a place where you can communicate your feelings and your life expectations. And we are here to nourish that, not to take over.
Yeah,
Yeah.
exactly. Beautifully said.
Yeah.
Thank you so much for taking the time to sit with me today. I know you
This is fun.
very, very busy schedule.
Yes, but you know, we have to reach those who can't, who haven't had that access to know where to go. We have to reach everyone.
Absolutely.
Yeah.
Seriously, thank you so much again, Kerisha. And
anytime.
Come over to the Bridge and see us.
Yes.
All right. Thank you so much.
You're welcome.
Thanks again for listening to Bridging the Gap. We're glad you joined us as we explore the space between the clinical and the human side of therapy. Be sure to subscribe, share this episode, and until next time, keep bridging the gap between where you are and where healing begins. If you or someone you know in Connecticut is seeking counseling services, visit www.bridgefamilycenter.org or call 860-313-1119 to schedule an appointment.